My name is Charlotte Hansen, the laboratory manager for Massey Public Health Laboratory. This training has been very insightful and very educative. As end users of biosafety chemicals, our interest should not only be on protecting ourselves and then the pathogens we are working with, but also on how to maintain the equipment to extend its longevity and then ensuring that it gives us the quality that we want when it comes to our results. So the training has been very beneficial, as I mentioned, and as a manager, I'll ensure that my staff do the adequate maintenance and the routine checks they need to do when working with the Biosafety Cabinet to protect the staff as well as ensure a safe working environment.
My name is Jacob Atakwam. I've worked in Ibuchi for the past 35 years. Safety in the lab has been an issue, but we've come a long way to ensure that laboratory staff work in a very safe environment. So this training has come very handy in equipping the laboratory scientists to be able to understand this equipment they work with, how to make it work safely for them, and how to elongate its life. At the end of the day, keeping all of us safe.
Hello, my name is Mami Fedankwalai. I am with the Ghana Health Service headquarters, particularly with the Health Administration and Support Service. This very initiative of Biosafety Cabinet training has been very beneficial because now we know we are not only saving the environment, the cells, and the reagent or whatever they are working on. It shows us the interrelationships between our various components and our various departments.
My name is Patricia Tichua. I'm from Genomics and Infectious Disease Lab, KNUST. I've had the opportunity to join this training on biosafety and biosecurity and how to understand the use of biosafety cabinets.
Hello everybody, I'm Antoinette Puma from the Ghana Infectious Disease Center in Accra. I've learned a lot from the biosafety training, and one of the important things I'm taking home is that the fact that you have a biosafety does not really guarantee your safety. So you have to do the proper maintenance and use it appropriately in order to get the optimal protection that is supposed to give to us.
My name is Sandosa Fiamaka from Ashanti region, Massey Public Health Reference Lab. I'm so much enlightened and I've learned a lot that will really help me, and then I'm hoping to implement it at my facility. My name is Dr. Sadia Imachulawa. I'm from Northern Region. I'm at the Tamale Public Health Laboratory. This training has really helped me to relearn and unlearn some of the things we do that we thought was normal. Particularly, some of the things I would like to input in our daily activity in our lab now is the airflow velocity check using the paper or the smoke, and also having a checklist of all the things we need to do before starting to use the biosafety cabinet so that we don't move in and out, and also having a documentation of our biosafety cabinet spillage whenever we get a spill, how we manage it.
My name is Isaac Abdul-Kudus, and I'm from the National Public Health and Reference Lab, Greater Accra. This training has helped me improve a lot on what I need to know about the basic biosafety cabinet. I'm going to implement this at my workplace and also teach my colleagues over there on some of the things I've learned.
I'm Sylvester Chimbwa from the Secondary Public Health Lab in the Western region of Ghana. I must say that it has been an excellent 3 days activity. Learning all about biosafety cabinet has been very revealing. Though we have been using biosafety cabinet for some time, but this has come to bridge the gap of being able to verify if it is functioning well, and even to start troubleshooting and addressing some of the problems that will bring a downtime in its use. I would want to say a big thank you to
The sponsor, the Center for Health System Strengthening, and all the facilitators for coming up with this program. They've really had time for us, and we've really learned a lot.
We say we are going to put everything that we learned here to use.
They're down for the biomedical engineers. You're doing it for the lab guys. I hope they extend it to the teaching hospitals.
To regional hospitals and other places where they also use similar equipment but may not be that much well trained.
It has been very beneficial, and we are hoping to have more of such trainings in the coming future. Thank you very much.